Hi everyone, I'm Dr. Alicia. So I have looked at almost 1,000 letters of recommendation in the past year, and unfortunately most of these are actually very generic, which doesn't hurt the applicant but also does not help them. A really outstanding letter can be the difference that can help an applicant that the program director is on the fence about get an interview or be ranked higher on the list. It can feel nerve-wracking because this is the only part of the ARES application that you as the applicant are not writing for yourself, and most of the time don't even get to see. So we can't control what the letter writers are saying, but we can do our best with my 4-step process to optimize the chances that they are writing very strong letters of recommendation for you. The 2 magic phrases that I'm looking for are that the letter writer consider you amongst the top of all students they have ever worked with. Top 20, top 10%, top 5%, the number doesn't matter so much as just that they're willing to say that of all the students they've ever known, you are amongst the best. The other magic phrase I'm looking for is that an applicant performed at a level beyond their level of training. So MS3 or MS4, performing like an intern or a resident is a rave review as well. I'm also looking for specific examples of outstanding performance that was important enough to make an impression on your attending. An example would be a letter writer saying that whenever the med student had a day off, that their patients would ask about where they were because they really saw the student as their main doctor in the hospital.
It can feel awkward or uncomfortable to ask attendings to write you a letter of recommendation. Another way to think about this is that every doctor, every successful person out there has gotten to where they are because people vouched for them, people wrote them letters of recommendation, and so it is part of the process of medical education, and so your attendings should expect that you will ask them to write letters.
So my first tip is to always ask for feedback at the end of your time working with someone. Even better would be if you ask for feedback in the middle of your time working with someone a few days into that time, so that you have a chance to show that you're hearing their feedback and you're incorporating it and improving your performance. The reason that it's such a good habit to build to always ask for feedback at the end of your time working with someone is because it allows you to build a data bank of all of these data points of how you're performing. Another nice byproduct of this is that it allows you, for every person you work with, to get a feeler for how they would do as a potential letter writer for you. So my criteria for a strong letter writer is someone who really is enthusiastic about teaching medical students, someone who, when you're doing feedback with them at the end, is giving you very positive feedback, ideally saying that you're maybe even above your level of training, although that's not required. Just very positive feedback, and someone who's able to have specific details of what you did, of your contributions. An attendee who says, "You did a great job. I really remember, the impact that you made on Mr. B and how, your bedside manner with his daughter was very advanced." You want someone to say something that shows that they remember specific details of your performance if possible, rather than someone who just says, "Good job." My second tip is timeliness. This is so important. So ideally, you would ask for a letter on your last day of working with someone or within a couple days of the last day. Sometimes I get requests to write letters from students that I worked with 6 months ago, and it's just difficult at that point for my memory to bring up enough details that I would be able to write a very strong letter for this person. If the only option you have right now is to ask someone that you've worked with a couple months ago, that's totally okay. It's not rude or inappropriate to ask, but if you do have the option of asking someone that you worked with more recently, that is definitely more ideal. My third tip is to help out your letter writer by giving them the documents that can help them succeed. So I always ask students to send me a copy of their CV, a draft of their personal statement does not need to be polished, just to give me a sense of their accomplishments, their life story, some of their motivation for going into medicine or going into a certain specialty. And then third of all, I asked them to send me a list of the patients that we took care of together and include what contributions they made for those patients. Like, for example, oh, this is the patient where I gave a talk on hemochromatosis, or this is the patient where you said that my differential diagnosis for their sepsis was very good. It may feel weird to toot your own horn by saying, here's all the things I did for my patients, but it actually really helps out your letter writer by jogging their memory with reminders of what you did, and it helps them write a stronger letter for you. My fourth and final tip is to continue the relationship. So once someone's written you a letter of recommendation, they have devoted their own time and energy to your career development. And so they're invested in you. And so, of course, say thank you, show gratitude, but also let them know what ended up happening, what's going on with you professionally. It's always really nice to hear from, former students like, thank you for your help. Because of your help, I'm now at my top residency. And then a couple months or years down the line say, oh, hey, I just wanted to thank you again. I wanted to update you that now I'm going on to fellowship, or I just got my dream job, or, to give these updates. And that also opens the opportunity for a mentoring relationship if your letter writer is receptive to that, where possibly in the future you could ask them career advice as well. So these are my 4 steps, my 4 tips for how to optimize your chances of getting the strongest letter possible. I hope this was helpful for you. Please let me know in the comments if there's any specific follow-up questions that you have. Thank you so much.